I've checked in the EHR. I see that there is an order for a head-to-toe assessment on Jamie. So I'm going to go ahead and do that. I'm going to knock. And I'm going to do hand hygiene. Hey Jamie, my name is Ellie. I'll be your nurse for the next 12 hours. How are you feeling?
I'm feeling good. I'm feeling,
Yeah, and how are you feeling emotionally?
I'm feeling happy.
Okay, great. Are you okay if I look at your wristband? What's your full name?
Jamie Carson,
And what's your date of birth?
November 1st.
Okay, that's perfect. And Jamie, do you have a preferred name?
Just Jamie is fine.
And do you have any allergies?
No.
Okay, that's perfect. Well, I'm here to do a head-to-toe assessment, check all of your body systems out, see what's going on. And it'll just take about 15 minutes, okay?
Okay.
Perfect. Thank you so much for being here. We're just going to get started. I don't see any tubes or drains or bandages on you at all. Is that correct?
Yes, that is correct.
And I don't see an IV. Is that correct?
Yes, that is correct.
Okay, if he did have an IV, then I would check the tubing for any bubbles. I would check the solution, and I would check the flow rate, and I would check the IV site just for any sort of infection or redness around there. Okay, Jamie, can you tell me where we are?
We are in the hospital.
And can you tell me the year?
2025.
Okay, perfect. So I can tell that my patient is awake, they're alert, they're oriented, they're able to hear, and they're cognitive, they're able to respond with their speech, and they're dressed appropriately for the occasion, and they're just doing great. Okay, that's perfect. And when I came in, I did a safety survey. I checked all over the floors. I saw that there's nothing hazardous to me or my patient. So that's super great. We're just going to get started with some vitals. Are you okay to put that on your finger? Okay, and I am going to just listen, or not listen, I'm going to feel, sorry, your pulse. Okay, your respirations were 18 and your pulse was a 94. So those are all within the normal range. And with your breaths, when I was assessing them, it looks like the depth was as expected, normal, and your breathing was unlabored and even, which is super great. Okay, and looks like your O2 is at a 95. And that is super great. That's within normal range, and that's just on room air, so you don't need any oxygen therapy. If he did, then I would note the delivery method as well as the flow rate. I'm just going to take your temperature. Okay, it is at an 98.3, which is within the normal range. Okay. Can I have your arm, please? Thank you. Okay, sorry, I'm going to twist this around. And okay. Can you hold this for me? Thank you. Can you hold your arm like this? Thanks. Yeah, you can just rest it right there. Okay, Jamie, looks like you had a blood pressure of 116/76, which is perfectly normal. Okay, and Jamie, are you in any pain right now?
No, I am not.
If he were, then I would ask about what is provoking the pain, what the severity is on a scale of 1 to 10, if it radiates anywhere, what the quality is, and as well as the timing, just how long it's been going on. Now, Jamie, I'm going to perform a neurological assessment on you now. You're going to just see a bright light. Just look straight ahead. Okay. And it looks like your pupils are at about a 5 millimeters. Just perfectly great. So Jamie's pupils are round, equal, they're reactive to light, and so I'm not going to test for accommodation. Now, Jamie, can you please grip my 2 fingers? Okay, the hand grips were equal bilaterally. Now I need you to pull me towards you and push me away. Okay, great. That was perfect. So arm strength is equal bilaterally, and I'd rate it about a 5. Now I'm going to be testing for edema. There's no edema present. If there were, I would check if it's pitting or non-pitting, as well as rate it on a scale of 1 to 4. And I'm going to do some capillary refill. Okay, that took less than 3 seconds to refill. And I'm going to test your radial pulses, which they're equal bilaterally with a +2. And I'm just going to look for any bony prominences. Looks like you are all good. I see no skin breakdown. It's perfect. Okay, I'm going to have you lay down. Okay, and you can put your legs straight. And can you feel my hands all the way down?
Yes.
Okay, and are you experiencing any numbness and tingling?
No.
Okay. And actually, I'm going to do that on your arms before I move on to your legs. Can you feel my hands all the way down?
Yes.
Are you experiencing any numbness and tingling?
No.
Okay, great. Okay, moving on to your feet. Okay, I'm going to check for, can you pull your toes towards your nose and press the gas pedal? Okay, foot strength as well as equal bilaterally, about a 5. I'm going to check for capillary refill. And that took less than 3 seconds to fill. And I'm checking for edema over bony prominence. There's no edema present. If there were, I would check if it was pitting or non-pitting on a scale of 1 to 4. As well as I'm going to check your pulses. Your dorsal-pedis feels like it is equal bilaterally +2, and your post-tibialis as well is equal bilaterally with a +2. Okay, and while you're here, I'm just going to, actually I'm going to have you come back up. Yeah, that is perfect. You can sit back up. Okay, and have you been coughing at all?
No, I have not.
Okay, well that is super great. What is, if he were coughing, I would ask about the frequency of that cough. And I'm just going to auscultate. I'm starting above the clavicle, listening side to side, being careful not to listen over any bones.
Oh, perhaps we should move the camera.
You're right, I should move the camera. Okay, I am starting above the clavicle, and can you pull your gown down for the rest of these? And I am making sure to not listen over any bony prominences. And can you turn over here so I can listen to your back? Thank you. I am just listening side to side, not listening over any bony prominences. Okay, that is perfect. And while I'm back here, I'm just going to test your kidneys. Did you experience any pain with that?
No.
Okay, and I'm going to have you lay down. Okay, and can you pull your gown back down? I'm just going to look at your contour of your abdomen. Okay, looks like it is flat. I'm checking to see if it is scaphoid, round, or protuberant. Thanks so much. And Jamie, do you have a cough?
No.
Okay, if Jamie did have a cough, I would ask if he was coughing up any sputum, and I would note the amount, the color, the odor, and the clarity as well. Okay, and this is also the moment where if it was ordered, I would teach my patient about incentive spirometry. Okay, perfect. Now I'm going to be listening to a little bit of your heart, if that's okay. I need you to bring your gown back down. Okay. I'm I'm going to be listening to S1 and S2 in the second intercostal space right on the sternal border. Okay, sounds like there is a regular rhythm, no extra heart sounds detected. I'm going to be listening to the apical pulse in the fifth intercostal space in the midclavicular line. And I would listen here for 60 seconds. Sounds like there's a regular rate and rhythm on that. Okay, and I'm looking at your extremities. Look like everything is dry, dry, warm, and pink, as well as I noticed in your back and your front. You also look warm, dry, and pink on all of your skin. I haven't noticed any skin lesions. Is that correct?
Yes.
Okay, so skin is intact. There's no wounds. I'm just going to test for skin turgor. Okay, skin turgor is good. That means that you're hydrated, you're young, you're active, so you are not at skin risk, which is great. As well, I checked over all of your bony prominences, so it looks like you're doing just fine. Okay, I'm now going to have you just lay down because I'm going to be assessing your abdominal area. Yeah.
Turn so you can see.
Yeah. Thank you for uncovering yourself. Yeah, there's some excellent photography. Okay, have you been experiencing any bowel pain?
No.
Okay, that's super great. I'm just going to begin by auscultating in all four quadrants. And if I didn't hear any bowel sounds, then I would listen for 5 minutes, but bowel sounds are present. And now I'm going to palpate. And if Jamie were experiencing pain, then that is the quadrant that I would assess last. Okay, you can sit back up. Okay, Jamie, when was the last time that you had a bowel movement?
Yesterday evening.
Mm-hmm. And can you tell me a little bit about that? What was the size? What was the color?
The size was medium, the color was brown.
Mm-hmm. And what was the viscosity? Was it formed or more loose?
It was formed.
It was formed. Okay, that is super great. And are you passing flatulence like normal?
Yes.
Okay, and have you noticed any change in your appetite or in your weight?
No.
Have you had any trouble swallowing?
Mm-mm.
And have you had any nausea or vomiting?
Mm-mm.
Okay, and for your GU tract, when was the last time that you went pee?
Probably like a couple hours ago.
And how big was that amount? Like how much did you pee?
Probably about a cup.
About a cup. And what was the color?
Straw yellow.
Was there an odor?
No.
And what was the clarity? Like was it cloudy at all?
It wasn't cloudy.
It was clear. Okay, and how often are you peeing?
Probably about 6 times a day.
Okay, great. So all of these are normal findings for my patient. If I found anything abnormal, then I would ask them about hesitancy, I would ask them about frequency, I would ask them about urgency, and I'd ask them about incontinence. Are you experiencing any of those, Jamie?
No.
Okay, and are you experiencing any pain upon urination?
No.
Okay, great. Now, can you bring your arms above your head? Okay, and are you experiencing any difficulty with your acts of daily living, like showering, brushing your teeth?
No, I'm able to do those on my own.
Okay, and I noticed when my patient walked in that they had a good normal gait, so they looks like their musculoskeletal system is really great. Do you have a history of falls?
No.
And have you been experiencing any episodes of dizziness?
Mm-mm.
Okay, that's super great. So my patient is not at fall risk. And do you use any assistive devices to walk, such as a cane or a walker?
No.
Okay, that's super great, Jamie. So that is going to be it for our entire assessment. Thank you so much. You were so great. If this were the hospital setting with my patient in a bed, then I would leave the bed in low with the bed wheels locked with the side rails up ×2, as well as the collet within reach. So now I am going to do some hand hygiene and I'm going to go document in the EHR.